Well, good evening, Manchester and surrounding communities, indeed the whole wide world on the internet. Welcome to the Progress Report for April 26th. It is Wednesday in Manchester, and that means the Progress Report and no railroad hat, so you know it's not Bob Backus. Bob is on hiatus. He will be back next week. He's out exploring in the the old northeast, the old northwest, up in Michigan. He's visiting family out there, and he'll be back next week. But today, I think you will be very pleased with what we're going to do with the show here today. We are going to explore a real hot button issue and many other things surrounding it. And we have two excellent guests. I will announce them first. Our guests are Kayla Montgomery, who is the Vice President of Public Policy with Planned Parenthood of Northern New England, and State Representative Alessandra Rodriguez Murray, who is in addition to being a state representative, is the Deputy Director of the Reproductive Freedom Fund of New Hampshire. I'm sorry, my handwriting is bad. The Reproductive Freedom Fund of New Hampshire. And we'll talk a little bit about those organizations because a lot of people have misconceptions, especially about Planned Parenthood, I think. So welcome to the show. We're very happy to hear you. As I said, as we were getting in the show kind of put together before we started here, the one thing we like to do is talk about our guests as people. We have a philosophy here at the Progress Report that nothing happens if people don't do it. These great concepts of things like the city or big tech or whatever that is, they're all made up of people. So if you wouldn't mind, let's start with Kayla. Could you just tell us a little bit about yourself, how you came to be here, how you chose this work that you're doing?
Sure. Well, thanks again for having me here tonight. So my name is Kayla Montgomery. I am the Vice President of Public Affairs at Planned Parenthood of Northern New England in New Hampshire. We're a 3-state organization, Maine, Vermont, and New Hampshire. And also Planned Parenthood New Hampshire Action Fund, which is the sister organization of PPNNE. I have been with Planned Parenthood for almost 8 years now, doing various things for the organization from advocacy and organizing and communications, and now I serve as the Vice President. I am from New Hampshire. I went to high school and middle school and college here. I love the Granite State. I am raising my children here. I have 2 little ones at home. I actually, after college, got involved in the 2008 presidential race, which was very exciting, working on the Seacoast. And after that, I moved into working for labor. And I was working for the Professional Firefighters in New Hampshire, great organization. And after about 5 years, I moved over to Planned Parenthood, and I got a lot of questions when I did that of, we went basically working for all men to now working for an organization that's mostly for women, and like why did you do that? And to me, it was a very natural progression, actually, because to me, if you are not safe and healthy, then nothing else in your life matters. So whether it's about safety and making sure that you are physically in a safe environment or being healthy and getting the care that you need, you can't really concentrate on anything else in your life if you're not safe and healthy. So to me, those two things of labor and of healthcare go so well together. And it's really why I do what I do every day, because I think we have to prioritize the safety and health of people. So that is why I do this. I did not think getting involved 8 years ago it was going to be quite this difficult.
Who
now,
did?
right?
I mean, who did? We
Yeah.
thought things were settled. I
Yeah.
understand where you're coming from.
Yeah, it's been big changes, but I'm happy to be here.
Well, that's excellent. Welcome to the show. We'll talk a little bit about Planned Parenthood later, but before that, people first. I want to talk to Representative Rodriguez Murray. Tell us a little bit about yourself.
Sure, thank you. I'm Alessandra Rodriguez Murray. I live here in Manchester. I've been here for about 10 years now. I was actually just saying I was born in Michigan, but I've been here since I was 5, so I feel like I was, born and raised here in New Hampshire.
Close enough, but not a native.
Exactly. But yeah, also work at the Reproductive Freedom Fund. I'm the deputy director there, and we are an organization that was founded a couple of years ago, back in 2019, to fund abortions for New Hampshire patients specifically, and share out resources for those who need them. And we've been able to expand and do some solidarity funding after the fall of Roe because of how much of an increase there was in need nationwide. But yeah, that project that I started founding the Reproductive Freedom Fund with Josie Pinto started at the same time as my political journey started. I had no intention of going into politics when I was younger. I wanted to be a librarian, and I was working at libraries when I was first recruited to come testify on a bill at the State House, and it was on minimum wage. And that experience really changed my life because I realized how easy it was to have my voice heard at the State House and what an impact my experiences could have. And I really wanted to be a part of making that more accessible to other people as well. So I left the libraries and I started organizing with a few different grassroots organizations, mainly centered around young people and housing. And then I ended up at the Reaper Fund when my friend and I started it together, and we're lucky enough to be able to support 3 staff now, all grassroots funded almost entirely. So it's been a really great experience, and I'm in my first term as a state rep as well. Kind of same thing. I wasn't intending to run. I was asked to, and I honestly am loving it. It's very, very, very challenging and very, there's a lot going on, very busy, but I really love being able to connect directly with people in my community and organizers in the community and bring their concerns to Concord. And especially as I'm a trans non-binary person, being able to represent that experience in the State House as well has been very meaningful for me.
Well, thank you once again for that, and welcome to the show. And I do want to talk about the Reproductive Freedom Fund. What a grand idea. Right there. Talk about low-hanging fruit, you know what I mean? But what a grand idea. So let's move away from the personal side of things. Let's talk a little bit about the organizations. And Kayla, I would like you to talk a little bit about Planned Parenthood. There are so many misconceptions about what that is. There are people who have in their mind that it's okay to go and behave badly in the vicinity of Planned Parenthood facilities. It's almost appalling. Stuff that my mom taught me as a first, second, third grader, you just don't do, and yet you guys have to put up with it so frequently. Tell us what the true story of what is Planned Parenthood. Where does it come from? And you did mention mostly for women, but it's not only for women. People don't even know that. I sound like Trump when I say that. But I mean, many people have a complete misconception. I'll let you clear that up.
Absolutely. It's a very old organization. Planned Parenthood has been around for over 100 years. Planned Parenthood Northern New England, which is a 3-state organization, Maine, Vermont, New Hampshire, began over 50 years ago. So we have been in the community for a very long time. We've been partnering with the state of New Hampshire since we began, so over 50 years until just recently. We have 15 health centers across our 3 states. Our flagship health centers are in Burlington, right here in Manchester, and in Portland. We have 4 health centers here in New Hampshire. We have Manchester, Derry, Keene, and Exeter. And at all of our health centers across the region, we do a wide variety of services. All of our healthcare services are affordable and compassionate and judgment-free and quality. And anyone who comes in our doors will be served regardless of how much money they make. The services that we provide, the majority is contraception. So it's birth control, it's IUD implants, and it's
hence
also
the name, right?
Right. That's the vast majority of what we do. But we also do a lot of other things, STI testing and treatment. This is one of our core services. STIs are on the rise right now across our country.
You're using an acronym.
Sure. STIs, sexually transmitted infections, or STDs, sexually transmitted disease, same thing. Thank you for pointing that out because that's kind of jargony, and we want to make sure that people know. So anyone can come in, have a testing and treatment. The number one sign of an STD is actually nothing at all. So it's important to go in and have a checkup and make sure that that you're healthy. So that is a core service. And we also, of course, do cancer screening, so pap smears, breast screenings, things like that. And then we, of course, provide abortion care. That's a service that we're proud of. That is a service that we perform at 2 of our health centers in New Hampshire, at Keene and here in Manchester. And we also do other services, like that we call them specialty services, and that includes vasectomies at some of our health centers, not all of them. That includes gender-affirming care at every health center, all 15 health centers we do that. It includes vaccinations, and sometimes we do behavioral health at certain health centers. So really, people can come in for a wide variety of reasons. People tend to focus on the abortion care that we do, and that is a really important part of the care that we do, but it's about 7% of the care that we do.
7%. I'm going to say that again, 7%
Roughly,
of the total care that you provide at affordable cost to whoever, depending upon the person that comes in the door, across New England, across all these health centers, 7%. To read the newspaper, especially the Manchester newspaper, you would think that the numbers were exactly flipped.
Yeah.
It's and I'm glad you had an opportunity to do that. So, Representative, tell us a little bit about your fund. What a great idea. I don't want to assume, I think just from the description, I know what this is, but I'd like you to tell us a little bit more about it. Educate me.
Absolutely.
I always learn something when I do this show, so help me out.
So we're part of a national network of abortion funds. Actually, most states in the U.S. have some form of abortion fund, and basically you can either have an internal one, like Planned Parenthood has one internally where they fund their patients' care, but we are there for the gaps, for other clinics or for when Planned Parenthood may have a need to help fund those gaps. So we collect money from the community. We're all community driven, and we pay no questions asked. We give money to the clinics to pay for patients' abortions. And we also have, again, like I said, with the fall of Roe, we've seen an increase in demands for different services. We're paying for plane tickets for people to come here, for hotel rooms. We have an abortion doula service, which is essentially someone who's trained to provide you care and support when you're having an abortion. We also have a Plan B distribution network. So we have free Plan B across the state at a variety of community centers, everything from like a library to a store where you can just go and get Plan B, no questions asked. So we're very centered
Plan
on
B is the morning after pill.
Yeah, the morning after pill, exactly. Yeah.
Which is not to be confused with medication abortion.
Yes.
Two different
Two
things.
different things.
And I'm glad you made that point, because we're going to talk about that. That is right now in the news, so we will talk about that. Excellent resource. Too bad we didn't have it before. Thank you for starting that. That's, people need this. And what you're highlighting, both of you, to me, is that this issue really affects lower income people in a very, I don't want to say more significant or bigger, but in a very profound way that might be lost to people who don't have those issues to deal with, and which is why your services are so important. You talked a little bit about funding. When we were getting ready for the show, we talked about funding. How many times have we read in the newspaper, you guys go up, and it kind of depends on the makeup of the executive council, whether the state is going to help you guys out. There are people that would like to cut your fund, and in fact, they've tried to do it.
They do.
But then they always realize, maybe I'm wrong, but my perception is that they always realize what a big mistake that was, and they come back and do something. Can you correct my misperception and tell me a little bit about what the history is?
They haven't yet.
Okay.
So we're still out. We're still defunded. So I think this is a really important topic, because I think what a lot of people don't realize is that no state or no federal funds can go to abortion care. So the Title X program is something that you might hear about when we talk about defunding. We talk about the Title X program. The Title X program is a national program that was established actually under the Nixon administration, and it was put under, it was created as a way to help communities grow and make sure that women could get access to affordable birth control, because everyone at the time believed that that was a really important thing that they could be doing for the communities. So back in '72, that program began, and New Hampshire joined right away. And so that money has always gone to help places like Planned Parenthood and other independent reproductive health care providers to be able to help the people that come in, to help those patients who cannot afford birth control or cancer screenings or STI testing and treatment. It is the government's way to help. Right away, immediately back in the early 70s when this program was established, it was made clear that that money could never go to abortion. So that has always been the way. For the last 50 years, there's always been incredible mechanisms to ensure that that money is not commingled, that money doesn't go to abortion fund or doesn't go to abortion care. Now, it should, because why is it that wealthy people are the only ones that can afford an abortion? That's not fair. And many states have moved to have their state dollars, their Medicaid dollars, go to abortion care. New Hampshire's not one of them, which is why abortion funds are so important. Abortion funds like the Reproductive Freedom Fund and the Laura Fund at Planned Parenthood to help people pay for that care that they otherwise wouldn't be able to afford. So that is the funding. It's Title X funding. And never in the history of Title X funding in 50 years has that money been commingled and gone to abortion care. So that's a really important
I don't mean
note.
to interrupt, but you will hear politicians in Washington say, money's money, it doesn't matter. Their business accounts are fine. But your business accounts are suspect, I guess is the point I'm trying to make. But I'd like you to say it again. In the history of Title X, there has been no commingling of funds.
Right, and it's
federal
not
money does not go to pay for abortion, even though the check may go into the building that this health care takes place.
Yeah, and it's not just me saying that, and it's not just you saying that. It's the New Hampshire Department of Health and Human Services and the New Hampshire AG, who is also saying those things because they audited us, which is fine, because we're showing them that, again, there's no commingling of funds.
I think that's an important point to make.
It's a really important point, but yet still, the New Hampshire Executive Council has voted 4 times to not allow Planned Parenthood into the family planning program, which is the Title X program. 4 times. And it's a really difficult time to lose funding. It's always a difficult time to lose funding, but now more than ever, we need to make sure that we can help patients, whoever comes in. Because if we've got patients coming from a lot of other states now. We want to be able to take care of people, and it's tough. And I think that the majority of people do not understand what the New Hampshire Executive Council is or the power that they have.
I can't tell you. We've had candidates come on the show, and the first thing we do is spend about 5 minutes explaining that, no, these guys really, they run the money. Okay, yeah. They don't give the press conferences maybe, but they run the money, and it's very important. And I'm going to repeat something we've said on the show before. You're not saying this, I'm saying this. The executive council districts are so gerrymandered right now that it's nearly impossible for a Democrat to have any impact on the executive council. I think they've thrown 1 seat. The fact that Chris Pappas was able to take that second seat was, or I guess it was the third at the time, was almost a miracle. But they corrected that error on their part, and they've got a lock on it. I want to repeat that the money that we are talking about here, that the executive council could allow you access to, is 100% for non-abortion health care for women. Routine checkups, birth control, hence the name Planned Parenthood. You want to know one way to reduce abortions? Have better birth control. I mean, so how can you take money away from that and then complain on the other side? That's me talking. That's not you. I know you guys have positions to maintain, but I have a TV show, so I get to say things. So let's talk a little bit about the situation in New Hampshire. You both alluded a little bit about people coming into New Hampshire. So what that tells me is that in other places, it's worse. Again, I'm going to refer to our discussion before the show. My perception is that it's not as good as people want us to believe it is. And why don't we start the conversation? Let's go back to the law that was enacted as part of the budget. In the last budget process. I'd like to, if you guys could talk a little bit about what that did to the state of abortion rights in New Hampshire. And then if you want, we can talk a little bit about putting a policy issue like that into a budget. And then we can talk about the governor saying, I can't veto a budget, even though he did veto the previous budget.
got a
But
lot of things to talk
we could
about,
go
don't
on,
we?
we could go on and on and on and on and on. But let's start there. Let's talk about that. What did that do to the state of the law in New Hampshire?
Yeah, absolutely. So for those who don't know, in the last budget period in 2020, some things were inserted into the budget that were non-budgetary items, one of those being a 24-week abortion ban, which at the time did not include any exceptions, I believe.
Right.
And it also included a mandatory ultrasound where any person seeking an abortion would have to get an ultrasound before the procedure, like whether they wanted to or not.
Whether medically indicated or
Yes,
not? you know?
exactly,
I think that's
exactly.
the real issue, right?
Yes.
We've got legislators getting right between that doctor and the patient.
Yes, absolutely. And then it also instituted criminal penalties for doctors who did perform these abortions. And we're at a time in New Hampshire, and you know, I think across the country, where we're seeing a decline in workers in the healthcare industry, and this definitely did not assist our issues here in New Hampshire. You know, we have doctors and nurses leaving the state for, you know, partially due to the kind of antagonizing they're getting from the legislature right now. So bills have been passed since to kind of roll back a little bit of that ban. There are some exceptions in place now. The ultrasound mandate was removed. However, when we tried to pass a bill this year to remove the criminal penalties, the Senate killed that and did not allow that to pass.
Let's stop right there. Brendan, I think we have a little video on that. Can you go to the third video I sent over? I called it New Hampshire Senate Rejects Abortion Rights.
Turning now to the Granite State, where the Senate has refused to affirm abortion as an explicit right. Lawmakers are still considering bills on both sides of the issue, but the Republican-led Senate voted 14-10 to reject a bill that would have codified abortion into law. Opponents say it was unnecessary because the current law prohibiting abortion after 24 weeks of pregnancy is clear. Democrats, on the other hand, arguing that codifying abortion rights was necessary after the U.S. Supreme Court struck down Roe v. Wade.
Meanwhile, a unanimous New Hampshire...
Bring us back. I think that's the Senate vote that you're talking about.
Yeah. There were two bills that they voted on that day. One was to remove the criminal penalties from that ban, and then, yes, the second one was HB 88, which would have codified existing abortion protections into law. So it essentially would have prevented further restrictions from being passed down the line, which is part of why abortion rights are so tenuous in New Hampshire right now. You know, we have a legislature that can flip back and forth every 2 years, and anyone can introduce a bill in any of those 2 years, you know, to restrict abortion rights further in New Hampshire. So HB 88 would have been really critical in protecting abortion for the future here in New Hampshire. Anything you would want to add, Kayla?
Yeah, I mean, I think it's just really important to remember that while abortion is safe and legal in New Hampshire up to 24 weeks, no one's denying that. That is a really important fact. Safe and legal doesn't necessarily mean protected. And we are one of very few states now in a post-Roe world where there's been no activity either way when it comes to before 24 weeks. So states all around us, or states all across this country, immediately moved in one direction or another. They moved to ban abortion within hours, days, weeks, months of Roe falling. Or they moved to protect abortion, codify Roe v. Wade, codify abortion rights, protect abortion rights, put it right there in state law, in black and white, or in the Constitution. And states were moving in one of those directions. New Hampshire has not done anything, has not moved in either direction. So yes, abortion is legal, but it is not protected. There is no proactive right to abortion in the law.
And let's talk a little bit about that. We're probably kind of moving the train of thought backwards a little bit, but all of this comes out of the Dobbs decision, which struck down a civil right based on our Constitution, the right to privacy. Now, that's what the Roe case was. It gave us a right of privacy, and as a result of that, the right to abortion followed from that. So they not only struck down abortion, the follow-on, they struck down the right of privacy, and there are many, many other civil rights or rights that we feel are civil rights that we've enjoyed for many, many years that they're sitting on a bubble right now. I don't want to get into that because it's beyond what the show can do. But all of this comes from the fact that from the time I was a young boy, when Roe v. Wade came down, and they didn't invent this right. They interpreted the Constitution. It's always been there. It was just identified. So my whole lifetime, there's been a right to privacy, and as a result of that, a right to abortion with reasonable limits. And the court put that sliding scale, the 3 trimesters. So there's been attempts and attempts and attempts. How much limiting can we do? How much limiting can we do? Now the right is gone. I cannot imagine how that throws everything into question. And I think that's what you're getting at with you know, the House gets reelected every 2 years. And even with a statute codifying Roe, would that not be subject to another legislature coming in? Don't we really need to get that into the state constitution, which is virtually impossible in New Hampshire?
And there was an attempt to do that actually this year, CACR2, which would have codified the right to reproductive rights in general into our state constitution. That needed a 2/3 vote to get through the House, and it did not reach that number.
But it did get a majority, which
But
is
it did get a
exciting.
majority, which was, progress. But that literally would have brought that question to the people on the ballot, and the people of New Hampshire could have affirmed what they've shown over and over again. That the people of New Hampshire believe that abortion is right, you know what I mean? And that would have given them the chance to solidify that. And I hope that next time we can get it on the ballot. But I do agree that getting it into the state constitution is necessary at this point.
Yeah.
What do you let's move ahead. The Supreme Court now, you know, we got Roe knocked down. We're going to leave it to the states. That was the theory. How long has it been? And now we have the mifepristone cases.
Yeah.
Where they're trying to nationalize. And first of all, tell us why mifepristone and why medical abortion is important. I understand it applies to more than just a decision to terminate a pregnancy. It is used medically in a variety of situations. Can you talk a little bit about that and help me out, inform me on the best practices or what that's used for?
Sure. So medication abortion is 2 pills. That's important to note that this mifepristone is 1 pill used in medication abortion. Medication abortion is an extremely well used. People use it a lot. 70% of all abortion care at Planned Parenthood is done via medication abortion. Because a lot of people will choose that because they can do it in the comfort of their own home, surrounded by their support system. It's a great option for people who don't have access to transportation or live in rural areas and are having a hard time getting to a health center. And it, sometimes it is just a choice that people make, and it is safe and effective up to 11 weeks of pregnancy. So it is a really important medication that has been used and it has been approved by the FDA for over 20 years now. Over 5 million people have used mifepristone since in the last 20 years, both for abortion care and for miscarriage management. So a really important drug that has been widely used and widely available. So the fact that now, 20 years later, this case came up is disturbing on a lot of levels. And I think it's also really important to note, as you mentioned, that the overturning of Roe, the folks who are anti-abortion will say, "Oh, it's a states' rights issue. It's states' rights, states' rights." We heard all along, it's states' rights. Well, yet this case came up, which would dictate what would happen in states, and they were also cheering that on. So I think it's really important to note that the people who are cheering on the overturning of Roe v. Wade and cheering on the banning of MIFI, the ultimate goal in this country for them is to ban abortion. And we know that. So for them to say it's states' rights, that's not actually what they want. What they want is to ban abortion, whether it's, a law in Congress or through the judicial branch. But they want to ban abortion, and don't believe them when they say it's a states' rights issue.
Now, what about the issue of having it available by mail? What is the social impact of that or taking that away? I can understand if we're going to take the states' rights issue at face value, that by allowing it by mail, you can allow abortion to get into a state that has decided it doesn't want it. Is that the gist of it? Is that the only point? How is having it available by mail an important factor?
So at Planned Parenthood, if you, some people can do abortion via telehealth and then have the pills
Okay.
sent. That is not an option for everyone. You have to be, I think it's about 11%, I believe, of the patients that go that route. It is not, it's not for everyone. Not everyone would qualify for that. So a lot of people do still have to come into the health center. And also a lot of people, not a lot of people, but some people, whether they qualify for a medication abortion or not, they want to go to the health center and have their abortion there because that is their choice. And we support patient choice, of course. So, we support people being able to make their own healthcare decisions. But having the availability of pills being shipped directly to the patient after seeing a provider via telehealth, of course, and having all of the patient's questions answered. Having that option is a really good, it's good for a lot of folks who, like I mentioned earlier, maybe aren't able to get to a health center, live in a rural area. I mean, we don't have a health center north of Manchester, so people, who live in the North Country, that's difficult for them. Getting childcare, getting transportation, there's many factors that make it difficult for people to get the care that they need. So having that option of abortion pills shipped via mail is legal and safe and works for a lot of people.
Okay. What do you think the outcome? Do you have any prognostication on what the outcome of this might be? I mean, it seems it's going back to the Fifth Circuit. We don't know what panel of the Fifth Circuit it's going to be. It's traditionally a very conservative circuit, but it's going to be the luck of the draw, I guess, as to what judges they get. Did you see anything in the Supreme Court's opinion that indicated any direction that this might go?
I think it's important that we celebrate the wins, right?
Okay,
so
fair
we cheered on Friday for sure, but of course it's not a win. It's not over. I mean, it's a temporary victory, but it's not over, and so we just have to keep paying close attention, and making sure that we still talk about it, and that people still know that this case is not gone. Being kicked down to the courts is not an official win, but we are able to breathe a little bit easier, I would say.
And this is going on. There are also state cases going on. State legislatures
Yeah.
are acting across the country. Bills are coming here in New Hampshire. And you're saying that there are people coming into New Hampshire for abortion care that you're helping. So they're coming from states that are even more restrictive than we are. Are you seeing a big influx? Do you have a pulse on that? What's been the impact on New Hampshire, and what's the result? How does it affect your ability to take care of New Hampshire patients, for example?
From my perspective, it's growing with time, because we're not like the closest state to a lot of people who are in states where abortion is now illegal. So you're seeing states like in DC and in New York, for example, they have had huge increases of people traveling there. And Florida was until, now recently. And as those appointments get booked up and they're, filling out months and months, then people have to go further and further to seek abortion
Something
care.
I hadn't considered. This is a very time-sensitive situation,
Yeah.
so you have to act quickly,
Yeah.
regardless of how far you may have to go. I understand.
Yeah, so now not only
Yeah.
do people have to travel farther, but they are having abortions further along in their pregnancy than they might have originally because they are just trying to, get all the financials, transportation, whatever together to be able to get this, time-sensitive care.
And this is, we're talking days. You're counting this in days, right? This isn't something where you have months to consider it. You're counting. I mean, even New Hampshire, 24 weeks. That's not a lot of time. It's not 6 weeks, which we've seen in some states. What is this? I'd like to go back. I started with it, and we kind of I maybe misdirected us a little bit, but I'd like to go back to the state of abortion rights, women's reproductive rights, men's reproductive rights in New Hampshire. I'm not going to make an opinion. Where do you think it stands? Are we trending good? Are we trending bad? Are we in trouble?
I think it's really important to remember that the vast majority of Granite Staters support abortion rights, support reproductive freedoms, and support privacy when it comes to personal medical decisions. We know that because poll after poll has shown that. This is a
big
state,
numbers too, not 50-50.
Big numbers. You look around and you see Vermont and you see Massachusetts and you see the progress that they have made, and it can feel disheartening. But it's important to remember that Granite Staters are just as pro-choice as they are in Vermont and they are in Massachusetts. What we have right now is a situation where our leaders aren't listening to their constituents. And gerrymandering does play a big role in that, particularly in the New Hampshire Senate, I would say, and Executive Council.
Yep, we've talked about that on this show many, many times.
Yeah. So I think it's important to remember that New Hampshire has always had a long bipartisan tradition of respecting people's privacy, particularly when it comes to reproductive health. I don't think that has changed. I think people are still there. I think what we need to do is make sure that our elected officials match up with the constituents. And we will keep working on that. We made progress in the last election, and I think we can continue to make progress. We need elected officials who don't just do nothing, but actually recognize that things need to get done, that we cannot just be in this limbo state anymore. For many, many years, it was okay that there was nothing, that New Hampshire law was silent on reproductive rights because that was who we were as a state. We were just pro-privacy, live free or die. We didn't need anything in law because we were all there. But times have changed. Times have changed in New Hampshire and in this country, and now we need proactive laws. We cannot just sit around and just hope that things will be okay, because one election can turn everything, as we have seen.
So how about Planned Parenthood? We've talked a little bit about your struggle for funding through Title X. Mm-hmm. Where do you guys stand? Are you strong? Are you under the gun? I understand you're in it for the long haul. I have no doubt about that because you've been here for so long. But where do you guys stand within your community of support? What's your outlook look like?
Yeah, it is very difficult to deliver health care in this country. It is very difficult to deliver health care during a pandemic, which we are still working our way out of. And it's particularly difficult to deliver health care for free for a lot of people. So that creates a tremendous amount of stress on a nonprofit organization who will continue to provide health care for free. We are not going to suddenly start charging people. Like, that's just not part of our mission. Or people who can't afford it, I should say. But this has caused, as Ali mentioned, this has caused an incredible amount of chaos and confusion on the entire reproductive health landscape. It's not just about abortion care, because what we are seeing is patients are coming to states like Massachusetts and New York because it's closest for them, and they're filling up their health centers. And then the people who live there can't get the care that they need in a timely manner. So then they're pushed further out. So then they're coming to Vermont and New Hampshire and Massachusetts. So we're getting more and more people getting pushed further and further out. And that has created an incredibly chaotic landscape. But it doesn't stop at Planned Parenthoods or at independent providers, because we're also seeing it all over hospitals and all over maternity wards. We have lost 11 labor and delivery wings have closed in New Hampshire in the last 20 years. And criminalizing our doctors who are performing abortions later in pregnancy certainly isn't a way to recruit and retain OBs.
And I'd like to talk a little bit about that because, again, people, Planned Parenthood, it's this monolithic thing. No, it's people. Your healthcare staff. How does that work? Are they do they contract? Do they maybe work in a hospital but contract with Planned Parenthood? Are they dedicated to Planned Parenthood? How and I assume it may vary from place to place because you have a job to do and you have to do it in the most creative way you can. But how does that work?
Yeah, it does vary, but for the most part, people are Planned Parenthood staff. And we have, sometimes we have help and different contract out with different hospitals, but for the most part, people are committed to this organization and a full-time employee.
You have physicians on staff as
Yep.
well, physicians and
nurse practitioners and midwives and MDs and healthcare professionals of all kinds.
I'm going to ask just another question because I don't know. Does every Planned Parenthood Health Center have a physician at all times, or do they rotate? I'm trying to get a sense of how well are you staffed, and I'm not trying to criticize or say, oh no, you're not staffed well. I'm just trying to get a sense of what this pressure has done to your staffing. I mean, maybe I'll ask the question that way.
Yeah, it is difficult. We certainly can't afford to pay people the same that you would make as a traveling nurse, say, or working in a hospital. But people support the mission of Planned Parenthood, and so they want to be there. But it's hard. It's always hard. Like I said, delivering healthcare during a pandemic is difficult. But yeah, we're fully staffed, and people can also rotate between health centers. You're cross-trained on a lot of things, and someone can easily get from Manchester to Keene to cover things and making sure that everyone is available.
How about the work environment? I alluded a little bit at the beginning of the show about people that just feel they have license to behave in abhorrent ways right out in front of you. I know that there have been safe zones set up. Can you kind of clarify that a little bit? What is the situation around your actual facilities? What rights do people have to do what?
People certainly have the right to free speech. There's no doubt about that. But it can be tremendously difficult on patients to have to walk through protesters outside. I was just there last week and had to go through it as well. So it's not like it happens to everyone, and it can be difficult for a patient who's already nervous. Maybe they're not coming in for abortion care. Maybe they're just coming in to pick up a birth control prescription or whatever it may be. But it can be difficult to go. Maybe it's their first time going to a Planned Parenthood. Maybe they don't know what to expect. Either way, they're nervous about going in, and then to have to walk through that. And maybe they're not saying awful things, but people don't always want to talk. Maybe they just want to go in.
It's
and
a
have
healthcare situation. Yeah. It's not a public discussion.
Yeah,
That's funny. I had that exact experience the first time I went to a Planned Parenthood. I grew up in a really conservative home, and my PCP had signs all over the office about if a doctor talks to you about birth control or anything else, it's done without the consent of this hospital. And so I was really afraid to talk to my parents or my PCP about anything. And so I went to Planned Parenthood, and at that point I was still coming to terms with my own thoughts about abortion and beliefs, and had all these fears of what I'd been raised to believe about Planned Parenthood. And to be accosted first thing when I stepped out of my car by people yelling at me about how I was killing my baby, and I was like, I'm just here to get a pill. It was a really traumatic experience for me, and I was a teenager, and I just think it's like you said, everybody has a right to free speech, but I think healthcare decisions are so personal and private, and I just don't understand how anyone thinks that you're doing anything productive by yelling at people that are in a vulnerable position like that.
One would wonder.
Yeah.
One would wonder. I want to ask you a little bit. Your experience with your fund are your transactions just strictly financial, or do you get to meet applicants? Is there a screening process? What's that process look like?
So essentially, how it works is we give funds, when people have an appointment. So they usually go through the clinic. So you'll reach out to a clinic, and they may ask you to pay and you can't afford it, and so then they would give you our number and you would call us, and we have a hotline that's managed by trained volunteers, and they'll answer the phone, respond to your text even. You can text us, and make sure that we coordinate with the clinic to get your abortion covered. So that's pretty much how it functions. They have the option to, stay engaged with us afterwards, but we never want to make patients feel like, there has to be a give and take, or that they have to share more than they want to with us in order to get the funding they need. We give it no questions asked, but we do have some great people that have stayed involved, women who have come and shared their stories before the legislature after having their abortions funded by us, and people who volunteer with us. And then we have other ways of interaction too we have a volunteer driver program, so people who are trained to give rides for patients to the clinics, or helping with, like I mentioned before, the abortion doulas. That's also like a volunteer team that can sometimes meet with patients either in person or over the phone to offer them support. So there's, moments of interaction, but our main purpose is to make sure they have no stress or anxiety around the financial aspect of their appointments.
Understood. Let's talk a little bit about the legislature. I know that you spend some time up in the legislature. You are in the legislature. How has that, you're a new legislator, so maybe my first question will be for you, Kayla. How has that changed, your reception in committees when you go up there? Is it the same as it's been? Has there been a change? Are the committees more contentious? I'm looking more for a feel of what's going on up in Concord politically.
Yeah, there's definitely been a change. I would say in the 2016 legislative, that was the first year I started at Planned Parenthood, and we always had, anywhere between 20 and 40 moderate Republicans on any given reproductive rights issue. Not all of them were, it's not like they voted as a block, and it's not like everyone was going to be on everything, but everyone was always willing to talk, and they might say, I'm going to be with you on this one, I'm not going to, there was good conversations happening about why, and people, like I said, live free or die, pro-privacy. That was the New Hampshire way. Definitely has changed a lot. But I think it's also important to note that those people are not gone forever. There are some moderate Republicans who are willing to step out on things. We saw, as Allie mentioned, we passed the repeal of criminal penalties out of the House, and 16 Republicans joined with that, which is a lot. 16 Republicans on a bill like that.
And did that pass the Senate? That did not pass the Senate.
They killed it about 2 weeks later. Yeah.
Which was the video of the other bill.
Yep.
Okay.
Yeah.
So the criminal penalties are still in place.
Mm-hmm. Yeah.
Holy moly! I to me, that's like if you're really trying to make mischief with reproductive health care, scare the doctors.
Yeah.
That really is effective. Let's put it that way.
Yeah, and that's certainly not care that happens at Planned Parenthood. That's care that happens in a hospital setting. That's mostly care that happens at Dartmouth.
Okay.
Or the Elliott. But
what's the difference? Is it possible to kind of differentiate? I had a misconception, so let's help me get through that.
So in New Hampshire, abortion is legal to 24 weeks. But in the Manchester Health Center, we do not do abortions to 24 weeks. Again, that is not care that any abortion provider would do. That is care that is done in a hospital setting. So,
okay. So you're strictly the early trial.
Early in pregnancy. Yep.
Okay.
Yep.
Understood. So what happens in a medical situation after 24 weeks? What happens?
Yeah, no, that's actually a really great question, and it's important to remember that at that point, most doctors are trying to take care of 2 patients at that point, and the majority of reasons that people need abortion later in pregnancy is because something is very wrong with the health of the pregnant person or with the fetus. And at that point, it's neonatal specialists who come in and help. And it's highly trained OBs who are working on these specific patients and just trying to deliver the best care possible.
Just by definition, these are people mothers who have carried these babies this long. I mean, this isn't. I've heard it described as these just careless people who were lazy and didn't get around to it. These awful images that are being portrayed, but these are people. This is a tragedy situation.
Yeah, I think anyone who's ever been pregnant, I myself have been pregnant 3 times, or anyone who has ever been close to someone who's pregnant fully recognizes that nobody wakes up at 8 months and decides they just don't want to be pregnant anymore. I mean, you might not want to be pregnant anymore because you're ready for that baby to come
actually,
out.
I do understand that very well.
I would like to sleep, actually, but no one decides to have an abortion at 8 months just because they feel like it. And people know that. People know that. And so I think that idea, and people just say that as like it's, people recognize that that's not how healthcare works.
Well, I'm happy to hear that, because I've always been afraid that, no, there are people that hear that and buy into it, and I just can't even imagine that that's possible. But, there's no accounting for how people vote, I guess. Anything remaining in the legislature, Allie?
At this point, no, right?
So that's it.
Bills,
With these 2 defeats in the Senate, that's it.
We always have the budget.
We always have the budget, we do. But I think because the numbers are so close, I feel like there's a lot less of a chance that they're going to be able to, put something in last minute. The chance is never 0, but I'm feeling optimistic about it right now, I'll say.
So as far as nothing more negative, but nevertheless nothing more positive at this point.
Yeah, we were able to defeat all of the bad bills.
Yeah.
And unfortunately, all of the good bills were defeated too. But, we, like Allie said, we got 2 bills out of the House, and that was great.
So, out of the House, died in the Senate. So Governor Sununu skates, doesn't have to make any hard decisions.
Exactly.
Right?
Yeah.
Is that how it goes? Because and I honestly, I would not want to see any policy made in the budget. It was wrong then. It would be wrong now. As much as I am with you that the policy needs to change, I don't think that's the way to do it. Even though it is available, I suppose, in theory. That's not the way to go. I'd like to kind of back it out a little bit. I saw somewhere that New Hampshire actually, of all the New England states, is the only state that hasn't codified Roe v. Wade, where we stand alone there. I think it strikes me that a small state governor who might have his eye on a presidential run might not want to have that kind of controversy, and this kind of plays into his desires. Tell me a little bit about the negative bills that got defeated. What were they trying to do, and how close did they come?
Well, there was a 6-week abortion ban bill. There was, I'm trying to remember what else.
There was a bill that basically mandated misinformation, that we would have to tell patients misinformation, and created a waiting period, which is just another barrier to care.
Yep.
And there was a really awful bill that we have seen before in New Hampshire, and we've seen it across the country, where they call it a quote-unquote born alive bill, and it's just full of misinformation and not how healthcare works. And fortunately, an incredible amount of providers and faith leaders and patients stood up to say that this bill is cruel and had no place in New Hampshire, and was really dictating how parents could grieve. And so that was luckily defeated. But
Those
2 years
are
ago,
bad bills.
it got through the House. So they're terrible bills. But
Holy moly!
Yep.
I've said that so many times. It's almost being in a different world. It's like being thrown back to the 40s or something, where there's this uncertainty.
Yeah, especially when we should be focusing on things like childcare and affordable housing, and
Well, it is funny, once the baby's born, nobody cares. Okay, they're on their own, but they unless they become a teenager with a pregnancy, then they care again, for a little while.
Yep.
I don't understand the ideology of it. I understand in big pictures, the big black letters, we all support life. I mean, that's actually what Planned Parenthood is doing, is supporting quality of life and keeping people healthy. Where do you guys get private funding? I mean, is that a major source? Do you get donations? How do you have large donors that take care of you guys? What can you do to fill this hole that the executive council is leaving you with?
Yeah, we are very fortunate that donors have been with Planned Parenthood for a very long time and have stepped up in these difficult moments. And we do get a large amount of funding from private donors, but it should also be pointed out that, you shouldn't have to run healthcare organizations on philanthropy. But that's what we have to do.
We've seen the bumper stickers. What if the Army needed bake sales? I understand. And how about yourself? How are you guys funded?
We are almost entirely grassroots funded right now, just small donor individuals.
Really? Small donors, repeat donors, that kind of
Yeah,
thing?
we have a monthly donor program where people sign up to give a recurring donation every month, and that almost entirely provides the cost of inpatient, like New Hampshire patient abortion funding. Since the fall of Roe, we've seen a little bit more opportunity open up in terms of grants and larger donors, but there's always like a little bit of an aversion to specifically funding like medical procedures and other people's health care. So we're starting to see some of those barriers fall away, but we are almost entirely just community funded.
So we're getting toward the end of the show. Before we get to sign off, anything else that I haven't mentioned or didn't come up in conversation that you guys think that our viewers might need to know or should be informed about? Have we hit all the points? I can't believe we have.
Well, I can talk about the Executive Council literally all day. So, yeah, I'll just go back to that. I think it's really important that voters understand how much power the Executive Council holds. And within, these last few years, they have not only voted to defund Planned Parenthood and Loving and Equality, which makes up 80% of the family planning program, but they also voted to defund after-school sex ed programs, and not public school programs. These are sex ed programs that parents have asked their children to do, and these are private. And I think it's a little bit alarming that the Executive Council, that 4 members of the Executive Council can make these incredibly important decisions that impact public health in New Hampshire.
Where can people go to get more information? I'll go one by one about your organization and find out how they can get in touch with their legislator. Where can they go for that?
Yeah, everything you need is at Planned Parenthood New Hampshire Action Fund.org, ppnna.org, and that's the same handle for all of our social media.
Yeah, and we're on social media, particularly Instagram at reprofundnh.org. reprofundnh is the username handle. And you can find our link tree in there, which has a link to our website. We always have contact your senator and contact your state rep forms there, as well as a link to donate and volunteer. So, yeah, look us up on social media.
Very good. Well, we've gotten about to the end of the show. I guess we've hit all of it. It sounds like, bottom line, if you want to get more certainty in policy, then you have to participate in the political process. The best way to do that is to get out and vote, pay attention, go to these websites, find out how to get in touch with your representative, and let them know that you are among the large majority of people in New Hampshire that believe reproductive health care is or should be a right, and support these organizations that are fighting for you and your cause every single day. Thank you both for coming to the show. We really appreciate it. Folks, don't forget you can catch us on YouTube. You can catch us on Instagram. We're on Facebook. Our podcast is up on Spotify. There's many ways to catch the Progress Report. And perhaps the best news of the night, Bob Backus will be right back in this chair next week and put on a really great show. We will be interviewing, actually Bob and Senator D'Alessandro will be interviewing Maxine Mosley, who's running in the special election in Ward 6. It should be a great show. Thank you for watching, and we will see you next week.